calling the meeting to order. We have a quorum. First item is approval of the minutes, which you all should have received. Is there a motion to approve?
I'll make a motion.
Is there a second?
Second.
All in favor?
Aye.
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 Aye. Opposed? The minutes are approved. We'll move to the health officer's report.
All right, in terms of respiratory illness, it's minimal for COVID, RSV, and flu across the state and in Wayne County. There were no COVID deaths in April or May so far in May. We haven't finished the month yet. There's an increase in congenital syphilis cases in Indiana, which has increased by 2,300% from 2018 to 2023. Most of these cases can be prevented. 40% of these cases were among mothers who were not receiving prenatal care, so they weren't being tested for syphilis. The 2023 data shows an increase in state syphilis cases of 16% in the female population, 8% in the male population. Wayne County has seen a 44% increase in our female population and 88% increase in our male population from 2022 to 2023. And the Indiana Department of Health created a congenital adult syphilis toolkit detailing specific guidance such as performing syphilis testing on all patients finding a positive pregnancy test, testing all pregnant patients at least 3 times during pregnancy, meeting with people outside treatment centers so that, for instance, emergency departments, jail or prison intake, local health departments, to pick up more people who are positive. Screening and treatment of all sexually active women and their partners for syphilis in counties with high syphilis rates. That's easier said than done. And then the last bullet point is obvious high-risk factors for getting syphilis, unprotected sex, multiple sex partners, etc. We need to drive our congenital syphilis rate down to 0. I mean, anything above 0 really isn't acceptable. Then there's H5N1, which I alluded to, I think, or talked about in my last health officer report, and that is avian influenza in cattle. This can affect beef and dairy cattle. It's more prominent in workers around dairy cattle because, for obvious reasons, these other cattle don't have as high, beef cattle don't have as high a human contact. It's a difficult condition to deal with when you think, when we had avian flu get into chickens, we would just slaughter all of these chickens. You think about a dairy herd, we can't go around slaughtering all these dairy herds, so we need to come up with some way of controlling avian flu in cattle. Then measles. There was a positive measles exposure from a child from out of state at the Children's Museum on Eclipse Day. I don't know how they discovered this, but good monitoring. At any rate, they chased all these contacts down and there weren't any cases reported from this exposure. The CDC has Indiana listed as 1 to 9 confirmed cases of measles so far. We've got 92% of our kindergartens immunized, which I'm kind of proud of, but as Becca points out, they always say it's 95% for herd immunity, so we're not quite there. 100% is better, just like 0 for congenital syphilis. 100% for immunization is a good number. So we haven't heard any more about measles from the Indiana Department of Health since April. So that concludes, Dr. Ryder, the health officer's report.
Thank you.
You're welcome.
Clinical director report.
Okay, so for Health First Indiana, our notifications of awards and denials was sent out on Friday. And so now we have to start the process of getting interlocal agreements or MOUs signed with those groups. So in your packets, this is the last section. You'll find the Hamilton counties. Looks like this on the front. It says Hamilton County up at the top. Hamilton County's version of an MOU, an interlocal agreement, and a grant agreement. And Jason, the director over there, is incredible and has graciously agreed to give me the editable versions of these. So I wanted to give you guys copies. Our original timeline was to get these out within the next week or so. So I realize that's, we didn't give ourselves a lot of time in that area, but kind of having this as a starting point is helpful. Let's see. Our 2025 Health First Indiana budget is due on June 1st. We've already approved that. I just have to move it over to a new budget template that they've sent out, so that'll be good to go there. And as of, that's supposed to say May 20th, sorry. May 20th, all 92 counties have opted in for 2025, so we will likely be at the minimum of our funding amount for what it says on the Health First Indiana website. Just kind of, that's helpful for me to know, I think. Data reporting for the very first chunk of our core service data KPI services that we're doing is due on June 30th, so that's kind of a big due date coming up. And then on June 15th, we have a report that's due that says yes, no, in progress, or in planning for all of the different KPIs. So it's kind of nice the way they changed it. It was yes or no before, so now we can kind of detail that we have tobacco cessation education and planning, or something like that. There is, Dr. Jetmore will be excited about this, there's a tobacco prevention and cessation workshop for Indiana Department of Health and helping us with our KPIs and evidence-based programming and all that in October. It's a 3-day workshop that I'm planning on going to, maybe take a public health nurse with me as well. One of the big things that I wanted to go over today is the other packet of papers that you have paper clipped together. It has a graph on the very front of it. So this is Wayne County specific data that we received from the Department of Trauma and Injury Prevention, and it details what's causing our injuries and what's causing our injury-related deaths in Wayne County. So for your kind of go over some of the highlights in the top stapled packet that you have, the data from 2013 to 2022 shows all injury-related deaths were at their lowest in 2020 at 85 deaths, but we've had a steady incline to 2022 of 96 deaths, with the highest being 112 in 2017 and lowest at 46 in 2014. The same trend is shown in the unintentional injury deaths category, and positive news, deaths due to suicide are on a steady decline overall over the last 10 years or so. Deaths due to homicide have been up and down over the last 10 years, with the highest being in 2021 at 9 deaths and 8 deaths in 2017. Otherwise, our average in that category seems to be about 3 to 4 per year. Our deaths due to drug overdose of all intents and specifically unintentional are generally up since 2013, but down fairly significantly from 21 to 22, which is the last year of data that we have within these reports. And just to give you some background, the reason for all of this is because one of the KPIs is to identify the #1 cause of injury and deaths, injury that results in death in the county. So that's kind of where all this data comes in. Deaths due to unintentional falls are up significantly in the county, so that's something that we may need to start program planning within the next few months. It's up 5 times from 2020 to 2022.
Can you differentiate whether they occurred in an institution or at home?
Not on this report, but I might be able to somewhere else. That's a good idea.
The other thing is age, with these older people, because then you can kind of focus on why did they fall. A lot of times it's, can we get these people to balance therapy? Or,
Yeah, that's one of the things at the trauma and injury prevention workshop that I went to get all of this was balance education and training and things like that. So they're actually piloting a Tai Chi program, which is really cool, I think, because I want to be a Tai Chi instructor. So I asked if that was an appropriate use of funds, and they said yes, but we'll see.
Don't start Tai Chi.
Yeah, we'll see how that goes. And then Stepping On is a new program they've started at the state too. So the state is going around and certifying different health departments to be able to offer that course. Fayette County is one of the first implementers, I guess, of the program. And so what they're doing, instead of having, some counties are having their own location and bringing people in, but what Fayette County is doing is they're going into like long-term care facilities and things like that to teach this Stepping On program. So it's pretty cool, and it's all about balance, I think. I wondered too, with kind of the time frame, if it didn't have something to do with COVID and people being at home more, being more sedentary, less balance, less, those stabilizing muscles are getting a little bit weaker with COVID. But anyway, that was just a thought that I had. Deaths due to motor vehicle accidents are generally down from 2020, but overall the last 10 years are steady around an average of 7 to 8 deaths per year. So that's kind of covering this first packet highlights. Now, I'm out of order here, so the bottom one that's in color is the one I'm going to go over next.
You're okay.
So this is the injury mortality trends from 18 to 22. So total deaths of any kind of injury, intentional or unintentional, was 463. The number one cause of death related to injury in Wayne County is unintentional poisoning, drug and non-drug combined. The drug overdose rate of all intents, adjusted rate per 100,000 people is about 2 times what the adjusted rate is for Indiana. And then on page 8 of the report, you'll see that our death rate of children ages 0 to 4 is just under twice that of the state adjusted rate, which I think is really important to know. Finally, last highlight in this one on page 10, you can see that overdose death rates for ages 25 to 65 are also about 2 times in Wayne County what the adjusted rate is for the state.
What ages?
25 to 65 in every one of those categories. They break it down by 10 years.
These are the most productive years of a person's life.
Yeah, we're 2 times on that adjusted rate per 100,000 people. Okay, and then the non-fatal injury summary 2022. So that's our other color copy. Just a few more highlights. Number 1 cause of our non-fatal injuries is unintentional falls. Number 2 is self-harm, which I thought was kind of interesting. There is a huge gap between those two, but from 177 down to 33, but still kind of an interesting tidbit there. On page 2, when compared to Indiana's rates, all of these categories are very similar except for Wayne County's motor vehicle accident injury rate is about half of Indiana's rate. And then self-harm is double Indiana's rate. On page 5, you can see some information about injury-related emergency department visits. Just wanted to make sure that you all saw that page because I thought that was fairly interesting. I'll give you a second to kind of look at that. And then finally, last one, on page 10, you can see pediatric non-fatal injury rates, and the highest cause of injury is unintentional falls or being unintentionally struck or against something. So I think these reports are really helpful because they kind of give us a place to get started with trauma and injury prevention being one of the big categories of Health First Indiana and the core services. So we're gonna kind of start looking at all this and seeing where it takes us programming wise. Our brains together. For our financial updates, I didn't prepare a full financial report this month, and that's because I'm meeting with the auditor this afternoon to kind of go over what questions he has, concerns that he has. They actually sent me a big list of things, and thankfully they were all pretty simple to answer. But I'm hoping that once I get some input from him, I'll know kind of more specifically what he thinks I should be reporting on every month as well. In terms of the State Board of Accounts investigation with Heartland, they asked me about 20 more questions last week and it's supposed to be done. So hopefully we'll be getting that report soon. Staffing updates, our position descriptions for the 5 jobs that were discussed last month have been sent to the consulting company that provides classifications and salary recommendations. And Dr. Jetmore and I have both been in contact with Lori from the consulting firm to kind of square away any additional needed details. We anticipate that we'll be taking the job classifications and the salary recommendations to the county council at the next personnel meeting, which is the beginning of June. You got anything else you want to say on that?
You know, I've met with Kim Clauser a couple times just to go over job descriptions that Wagner Irwin wasn't clear about, and so they should have a pretty clear description of what each position does.
Okay. So this is kind of the miscellaneous area of administrative and clinical updates. We're officially up and running with the Indiana Health Information Exchange. That was a contract that we made movement on, probably at the end of 2023 sometime. And since then, the Indiana Department of Health has decided to contract with them for all health departments. So that's kind of cool. We're a little bit ahead of the curve because it takes about 6 months to set up your profile. And we are officially live and figuring it out right now. What that is data and medical documentation sharing across the entire state. And there's almost 90% of like the hospitals, doctors' offices, et cetera, participate in data sharing within that program. So that's really helpful for like a case investigation. If we were to get a measles case, we'd have access to all the doctor's notes on that particular person throughout the entire state without having to do any kind of request. So we're figuring that one out. Doing some training. We did train the trainer with me and one of my other clinical staff, and then we're going to start implementing bite-sized pieces with the rest of the staff. 5 staff members, including myself, are in the process of being trained on our new inventory management system, which is embedded in our EMR. We've done 1 of the 3 trainings so far, and I think it's going to be really useful for us. It all involves scanning a barcode, and then it updates our inventory system. We primarily got it for vaccinations, but we're finding out we can use it for Band-Aids and all kinds of fun stuff. So I think it'll be really cool for us. We are undergoing a garage organization project right now. They started last week, kind of decluttering, getting rid of stuff that is either expired or was kind of in the COVID pandemic era. We've had a clinic ask for some donations, so I'm kind of keeping that in the back of my mind as we're going through things, but I don't know what that process looks like yet, so I'm going to have to find that out before we do anything like that. Conference room. So I think I told you guys before we removed all the cubicles in the conference room and we're kind of revamping it. We have found tables that actually they're probably similar to these on wheels that can be set up conference style or classroom style. We're going to be seating anywhere from 20 to 24 people in both of those orientations. So I anticipate that we'll be moving our meetings over there at some point, but we're still working on sanding and spackling and painting and all that. So more to come as we move along with that. Logo wear, we had budgeted, or there was a previous budget with some money for logo wear, so we're going to be looking. I surveyed all the employees a few months ago to see what their preferences were in terms of, do we want t-shirts, do we want polos, do we want jackets, things like that. And so we're kind of pricing things out, trying to find the best price and the best company that will offer everything that people are looking for.
So what did they decide?
So they want, what do you call that jacket?
It's like a windbreaker, so when we're in the field in between spring and fall and it's raining, we have something to keep us warm and water repellent.
It's good for mobile clinics too on the clinical side. Polos, definitely. People were excited about that. Something easy and professional to throw on that's got the health department logo on it. Do you remember some of maybe long sleeves?
A lot of people want the long sleeve style t-shirts.
We had some weird things too, like cardigans and like special hats and things like that. So those are outliers that are not going to make it into the final order. But
I mean, in my opinion, a jacket and a few polos should suffice
Yeah.
to outfit them for whatever they need.
Okay, AmeriCorps. I wanted to just briefly touch on this. We've been in partnership with Bridges for Life, helping to host an AmeriCorps member since October of 2023. There's some public health and harm reduction components to that, and that's not something Bridges for Life does, so we kind of stepped in to help assist with that programming. And AmeriCorps was really impressed with us and asked us if we want to host our own person. I've done some digging on what that means, and it is something that we pay for as a sponsorship for that person. That can be anywhere from 14 weeks to 53 weeks that we would host this person. The 14-week program, I guess I should mention too, it's Monday to Thursday full time, so 8 to 5 Monday to Thursday, or it would be to 4:30 for us. For the sponsorship, if it was 14 weeks, it's about $2,200 for the entire 14 weeks. If we decide to do something like the full-time 53 weeks, it's $8,500. So I wanted to plant that seed in case it's something you guys are interested in. Dave, our physician assistant, had asked me about hosting them because a lot of their focus is harm reduction and Hep C testing and treatment. They actually sent me a list of what some like typical titles are, because they do a lot of training before they come and work with the health department. So things like hepatitis C support, case manager, outreach specialist, public health emergency response, prep engagement specialist, linkage to care specialist, things like that. So there's kind of a cool list of things that we could ask for. Just something I wanted to plant the seed on for now.
So is it basically an internship?
Yeah, that we pay a sponsorship to AmeriCorps for.
But they're not employees?
No, they're not
Anyway.
employees. Nope.
But we pay for the program.
We do, yeah, and I think it's because they get an education stipend too, because I was looking at the math throughout the application. It's almost exactly the same amount, their education stipend, based off of how many days you end up hosting them, or how many weeks you end up hosting them.
How helpful these people been in the past?
Well, we only have our AmeriCorps person 1 day a week because he's actually a Bridges for Life AmeriCorps person. It's something that Indiana Department of Health has recently started promoting for people to do, and so I would assume that that's a trusted partnership, but I don't know that for sure. Our AmeriCorps person has been awesome, really innovative, new ideas. I will say sometimes it involves a little bit more work for me if he has a question about like a project. We were fortunate because our person in Wayne County was actually the team lead for the leading district team. So there's a team of 6 of them. They're all in different counties kind of surrounding our area, and then Jesse is his name, was the team leader for that. So they ended up doing a presentation at Ball State, and they did a presentation at the Harm Reduction Quarterly meeting and things like that. So because they were kind of a more influential team in the program, it did involve a little bit more work for me, because there was some interviewing, and I need this data, and where can I find this, and how can I do that, and but I think it was valuable in the little bit that we worked with him.
I was calculating if they work 32 hours a week for 14 weeks, and we pay $2,200, they're making about $4.90 an hour.
And that was kind of my perspective on it too, is that if we do decide we need kind of support in this Hep C area, that would be a more affordable way to go about it, or get our toes wet with it kind of thing.
But they're not gonna be highly trained people. I mean, they're coming here to get.
So what Jesse has and what is standard, I guess, is community health worker, and they have the same IDOH and CDC STD, STI testing training that we have at the health department. So at least from that perspective, I could see maybe with like the jail programming, using this person to help us kind of get that off the ground.
Do you know if they'd
Otherwise-
give us the ability to background those people?
I'm sure that they do, but no, I don't know that for sure. They sent me, I have a binder of documents from AmeriCorps because there's so much depth to their contract and things, with the participant, not with us. I wanted to know what exactly does this contract look like? What are they supposed to be doing? And,
Yeah.
it's a lot. So,
Have we ever done this before?
we haven't, no, we just offered to help with this one. So it's not even our contract, we're not even actually hosting and we didn't have to pay anything for it. It was just kind of helping Bridges for Life check a box.
So we can find out if we like it without even getting into the shallow end of the pool.
Yeah, and he's been with us since October and will be with us through the end of July. So it's been,
So what's the deadline for it?
I've asked that question and I've been told two different things. I've been told the end of August and then I've been told, well, actually you can really apply anytime. You can really bring someone on anytime. So I'm not really sure.
I think it would kind of depend if we could define there where it would be helpful to us,
Okay.
Yeah.
where we would get a return on our,
Yeah.
Yeah, kind of a job description.
Mm-hmm.
and it sounds like it's another way we could extend ourselves without adding employees.
Right.
The application asks a lot of those questions, like where would you use this person? What's your mission statement and the division that you use them? And so maybe I could kind of answer those questions and send it to you guys to see what you think.
Well, I think it's kind of what you and the department think would be helpful
Yes.
Yep.
Okay.
and help further our mission.
Yeah.
Just a quick update, so we are a regional hub for a new lab courier program. I mentioned it to you guys last month. It's going really well so far. We've kind of figured out, okay, we need to have this space labeled in the refrigerator and we need to have, a protocol written out. So if, somebody's filling in at the front desk when the courier comes to pick stuff up, so we've kind of figured out all those details over the last month or so. We got asked to do a customer satisfaction survey, so we were able to give some feedback. And then, the data use agreement is in your packet. We don't need to go over that, but that is what the Indiana Department of Health kind of needs us to abide by in order to be kind of appropriately following HIPAA compliant packaging and things like that, because it is a separate entity that is couriering these labs for us. I found out last month that we are a site for syringe, I'm trying to think of what they call it, syringe remnant testing. So Marion County's been doing this for about 3 years now, where they send in their syringes just kind of sporadically. I don't know how they pick, but and then the Indiana Department of Health tests what's inside the syringes, so you know what drugs are being used in your county by your syringe exchange participants.
Interesting.
Right. I thought that was kind of cool. I know that the sheriff's department recently purchased a machine that was very expensive, from my understanding, that sort of does the same thing, like tests remnants and tells you what's in it. And so I'm hoping that maybe I can work with the sheriff's department to say, hey, this is what we're able to do now. So that's kind of up and coming. They're going over things between, I guess it's a partnership between harm reduction and trauma and injury prevention. So they're kind of working out like a MOU between the two departments. And we found out they're going to do some environmental lab couriering too.
They've started some, so they started picking up our lead, dust wipes, and different sampling we do for lead testing, which saves us about $20 for every lead case that we have, because we were shipping it by FedEx. To my understanding, they're going to be introducing water sampling as well, which will save us a lot of money, because each water sample that we currently take, because they're time sensitive, we have to drive them to Indy's lab. So it's about 3 hours of employee pay, gas, all that good stuff in the vehicle. So it's a really good program that the state set up.
The same cost benefits have translated with our STI, STD testing too, because we pay to ship those. On SSP, or the syringe exchange, we had a site visit last month. Your site visit letter is on the letterhead in the folder. Overall, pretty good feedback that we got. There were a couple recommendations. One of the main things that we're not doing enough of, they feel, is participant feedback. So we talked about doing a survey or something with our participants. Something that another county does is uses a whiteboard and puts a question up at every syringe exchange, and then the participants get the chance to answer the question. So we might do something like that. We had an employer, a contractor, had surgery, so we temporarily have changed the location of the syringe exchange to just the health department for now because of that change. I talked to him this morning and he thinks he'll be back next week, so good recovery going on there. I have felt, and this may just be because I'm picking more of them up since he's been out for surgery, I have felt like there's been an increase in the number of calls that we're getting for syringes out in the community. And so I wanted to share that. However, I did some research, and the national average for syringe return rates from SSP, so how many syringes are we putting out and how many are we getting back, is 90% return rate. And Wayne County for the first quarter of the year was 98.5%, so about 8.5% above the national average,
great.
which is, yeah, really, really good.
That's certainly something that comes up when the program is
Yes.
being
Yes.
relooked
Yeah.
at for
Yeah.
renewal.
Yeah, and ours is excellent, so.
And some of these needles found when dispatch sends this information to us are not always
Syringe.
drug use syringes.
Yeah.
you know,
Exactly,
so-
or, yeah, cause aren't the syringe support needles identifiable, like?
They're not.
They're not, they used to be, I think,
well,
okay.
So I did some looking into the law, and apparently Indiana's one of the only states that doesn't require that. So
Okay.
maybe before I was here they were identifiable, but now they're not.
Okay,
And that's been more of a cost thing.
got it.
However, I can tell when I go out and I pick one up that's not ours.
Yeah.
But I do think at some point that that's probably a good idea, so I'm kind of working that idea through my mind right now. FEMR, so our FEMR coordinator position has been open for a little while, and Dan and I are interviewing with our community health worker that's part-time in that position, or in that program, interviewing an RN candidate for that on Friday. Cynthia is our part-time FEMR employee, and she's currently progressing well through her community health worker certification course. Safety pin, so I communicated with the department director at Indiana Department of Health to kind of talk to them about our sub-granting plan. And so what they're doing is a contract revision request to allow us sub-granting, so I'm just waiting on that right now. But it seems like a fairly simple process. School liaison was easy peasy. I don't know why there's not more regulation in this area, but that's, not my prerogative. Anyway, she said that she thinks what we're planning on sub-granting for that is incredible, and there's not really anything that we need to do. She recommended having a local agreement in place, though, between us and them, which we're already planning on doing. That's everything for that. Oh, no, one more thing. So we've seen an increase in vision and hearing screenings requests from the schools. We don't currently have the equipment that we need for that, but we're pricing it out right now, especially because we have such a lump sum of funds there. Immunization, we've pre-placed our seasonal vaccine orders for COVID and flu so that we don't have another issue like we did last year. The grant cycle for that one ends July 31st. All invoicing must be through August 31st. We've been approved for our next cycle, and we got about 25% increase in funds, and we are underspent on that grant right now. So the Department of Health is kind of flashing red lights at us saying we don't want to have to return this money to the CDC, so let's talk about how we can spend that effectively. So that's a meeting that I've got coming up. Let's see, Start Smart clinics are a requirement with Indiana Department of Health for school-age children to be immunized at the beginning of the school year, so we're getting all that stuff planned. It'll be uploaded on a map with the Indiana Department of Health Start Smart campaign, so people will be able to go to the map and kind of toggle over the county and find out where we're doing immunization clinics around school start time. We also partnered with MD Wise last year to host a large vaccination back to school event, and we're in the process of planning that again this year. Almost done. Lead. There's a daycare lead testing program that's being implemented at the Department of Health. And we bought a new lead machine early fall last year, and then there was a recall on it. So it's been sent back. They're supposed to be sending us a new one, and when they do, everyone's going to get trained on how to use it so that we can participate in the daycare lead testing program with the Department of Health. And that is all I have.
Thank you.
Lots of stuff.
Mine's gonna be a lot shorter.
So you think, we have questions.
Yeah, unless you have questions. Tomorrow, we go to court on the non-compliance of the house just south of our parking lot there at the health department. We're gonna ask the judge for a permanent injunction, and this is the third time since I've been with the health department that we went this far, so I really don't know what the future's gonna look like with that injunction. On June 12th, I'm scheduled to speak before the Realtors Association here in Wayne County. That is to educate the realtors on septic and well issues in the county. Everything from installation to repairs to investigations to real estate transactions, separation distances, everything that there is, and that meets one of the KPIs required by the state. Jason Howard, our environmentalist that does pool inspections, I sent him to Indianapolis this couple weeks ago. He got recertified as a pool operator, so he can continue to inspect the pools. That's also a KPI for the state. And then Tim Croucher, our new environmentalist, I sent him to Purdue, and he is licensed as a, I believe it's called an Applicator 8 license for vector control. So he has the ability to fog if necessary and all that good stuff. So. The TRP, the Technical Review Panel, the septic ordinance that this board approved and then the commissioners approved, was sent to the TRP for final approval, and that was a part of that meeting Friday, and they did approve it. So the ordinance is
We're
in
one of
place now.
very few
So
in the state.
hopefully we don't have to go through this again. We're in discussions with Union County, reference helping them with lead inspections and risk assessments. They do not have a certified lead risk assessor, along with a few other counties like Randolph County, Fayette County, a couple of the smaller counties. So we're working on a partnership with these smaller counties, and we'll send our lead inspectors down there to help them out. We will eventually come up with an MOU or a contract, so we are reimbursed for our supplies, time, things of that nature. And then we'll send them the information, and they'll get to report that for their KPIs. With that said, I have required that any county that we go into and help is their attorney writing the contract or the MOU, and that any enforcement action will go through their county attorney and their environmental. So all we're doing is the physical labor in a sense. But if that comes to, then I'll ask the board for permission before we enter into anything, obviously. So just to make you guys aware of it.
Along that same trend, we've been talking to a lot of those same counties with that don't have someone to fulfill the service for STI and STD testing too. And so I've been working with the Health First Indiana Central Regional team on number one, meeting with those department directors, each Fayette County, Union County, Randolph County, and they're looking at what are the technicalities as far as reimbursing you for doing this service for us, who should be reporting what data, things like that. So we've had one meeting so far, but we're gonna have another one soon, I think, to talk about the lead and the STI, STD stuff.
Is any of that gonna overload our staff?
I'm not going to allow it to. So they originally had asked for weekly STI, STD clinics, and I just said that there's no way that we can provide that sort of support to them. I don't know if now they're talking about working with other counties too. What they wanted would, it would overload our staff, but there's no way we can.
As far as the lead part goes, it really depends on how many counties jump on board. If we're only helping Union County, it shouldn't be an issue. If we end up helping 2 or 3 counties, it may become an issue. But in those contracts, I will ask that we're able to deny, due to staffing or whatever, any inspection. We will take on if we can, but if it is a staffing issue, that we're able to back out of that particular inspection.
Like Union County, for example, they said does like maybe 3 to 4 lead risk assessments a year,
not many.
and we do what, like
Anywhere from 15 to 25, if not more, a year. So,
Yeah.
And I would have to assume Randolph County would be similar as far as numbers go to Union County. So we could definitely absorb 10 more inspections a year. And those approximately $500 to $600 a piece is what we'd be reimbursed. That's pretty cheap.
Any other comments, questions? Old business? New new business? Comments? Next meeting is June 18th. That work for everybody? Well, I would entertain a motion to adjourn.
Almost. So moved.
A
Second?
second?
All in favor?
Aye.
Aye. Opposed? Thank you, everyone.